The Brookings Institute found blacks are 3.6 times more likely to die from COVID-19 than whites. They also found stark differences in COVID-19 death rates for Latinx and indigenous populations. The majority of deaths are among the elderly, but younger blacks are 10 times more likely to die, and younger Latinx are 8 times more likely to die. Conversations about race are abstract and passionate, but as a doctor, I want to break this data down and share with you the science and the main drivers of this alarming disparity. Initially, the coronavirus hit cities with large minority populations who relied on public transit. But there's more to it than this. There's systemic factors and there's individual factors. On the systemic side, there's housing density. More minorities live in areas with more people and houses per square mile. This makes it harder to socially distance, and thus there are 2 to 3 times higher COVID cases in these areas. Essential jobs. More minorities work in essential jobs like public transit and grocery and cleaning, ones that have high daily risk of COVID exposure. Air quality. Historic redlining that concentrated many minority communities into lower value areas near factories caused generational exposure to pollution. A Harvard study of 3,000 U.S. counties found a strong link between chronic air pollution and COVID-19 mortality. Next, we look at individual health factors. The CDC has identified at least 7 health factors that increase the risk of coronavirus complications. And for every age group, African American, American Indigenous, Latinx, they have at least one. A few examples are type 2 diabetes, where blacks are 50% more likely to have type 2 diabetes, and this increases their COVID hospitalization 2 to 3-fold. High blood pressure. African Americans are more likely to have high blood pressure at an earlier age. A Chinese study of 2,800 COVID patients found high blood pressure doubled their risk of death. And there are similar trends for obesity and kidney disease. So as a country thinks about race and coronavirus, these data need to be part of that conversation so that policymakers and individuals can come up with the specific strategies they need to address this alarming gap.